do you focus on the appearance of breasts while performing a reduction? So the answer of that is yes, very much so, but that is not the only thing that you focus on when you're doing a reduction. There's a couple of things you need to be aware of in relation to the nipple areolar complex. So when you're doing a reduction, you're doing a lift. The lift is an integral part of a reduction, and you have to move the nipple to a higher place, and so you have to isolate that and keep enough blood supply and nerve supply on the nipple. So that's a really important part of the surgery. So that dictates the size. So that's an element of the size that's important, but clearly the appearance is important for a breast reduction. It's actually important for everything that we do. And one of the things about plastic surgery, and certainly plastic surgery training, is that there's an element of form and function. It's the function of things is important because how they work. A lot of things we do is like hand surgery and what have you, and things have to work properly, and head and neck surgery. But also the form is clearly a very important aspect to it, and that is something that's kind of drilled in throughout all of plastic surgery training, that yes, the function has to be there, but also how things look. So there are some technical and functional aspects to a breast reduction which are important, but also there are cosmetic elements, and clearly the cosmetic elements is a huge aspect of performing breast reduction. So yeah, it's a very important aspect. And so when one of the things I do is I make sure there's enough volume in the cleavage area. I make sure I empty it out laterally, because often there's too much volume laterally to the sides, and trying to make a good shape with the nipple at the apex, sort of pyramid shape, with a good projection to the breast, because you don't want it too flat. Right, I've got some questions here. So you don't want it too flat. So those are all important aspects to it. So the important is absolutely the appearance is absolutely crucial, as well as the function of the breast in terms of the nipple sensation and the blood supply to the nipple.